Hello everybody, so my name's Lottie. I work here at Embrace Nutrition. I am a physiotherapist as well as a functionally trained nutritional therapist. And the reason I wanted to bring you a video about pelvic floor is because we work with people's health from top to toe, and the amount of people who come to us at Embrace Nutrition with something potentially unrelated to their pelvic floor, and then as it comes out, because we're talking about their every section of health, comes out that actually they're struggling from a pelvic floor point of view. So the amount of times I'm doing individual videos, I thought, why not? Let's do an overall video for everybody to get access to at least start the process of looking into pelvic floor health. So I used to work as a women's health physiotherapist, where we obviously used to get women coming in that potentially were pregnant with pain in their pelvic floor, with their pelvis, potentially after delivery, having caused some problems. And then also menopausal women struggling with prolapses. And then really sadly, we'd have men come to our women's health clinic and obviously find it incredibly difficult because it is called women's health. So from now on, we're not calling it women's health, we're talking about pelvic floor health. So we are very, very inclusive of men and women alike, because guess what? We all have pelvic floors. So welcome to my presentation. It is just a start. And obviously, if you do need any more support, please head to your GP. Get a referral for your pelvic floor health, whether that be men's health, women's health. Okay, so what and where is our pelvic floor? Well, the floor of our pelvis is literally that. It does include going from our tailbone and all the way to the little bone at the front, and it literally holds everything in. So funnily enough, over our lifetime, it does get a little bit stretched, sore, overworked, and underpaid. So what we actually need to do is try and support this muscle as best we can. So you can see I've got women picture and a male picture, and we can see that everything above that, it's trying to hold in. So it does lots of jobs that we need to try and support it with. So unsurprisingly, we get some problems. So why is exercising the pelvic floor important? Well, we all put pressure on it, whether you've never been pregnant before, whether you're a male and you think, well, I don't put pressure on it. If you've ever been constipated and straining, you're putting pressure on it. If you've ever had a chronic cough, guess what? You put pressure on it. If you're overweight, obviously the amount that hammock has to hold in is more. If you've ever been a heavy lifter of boxes of weight, then you may well be putting strain on it, and longer term you might find that you are struggling a little bit. We tend to sit and slouch for a really long period of time, particularly at the moment where we're all sat definitely more than we used to be. And actually it's really important to remember, when we're sat and we're potentially hunched over and we're not activating our muscles, then actually those muscles are going to get weak, just like everything else gets weak if we don't use it. So we particularly know that after or during menopause, that hormonal changes affect that. Our pelvic floor, and we know that we can potentially become a bit weaker. So what we want to try and do is get you before that you go through the menopause, before we have problems, after you've had your children, potentially before you have your children, to make sure that we've got a nice strong pelvic floor. So we need to make sure that we're supporting everything that is above our pelvic floor, including our urine tube, our vagina, the rectum, and in men, the prostate and the bladder, obviously. And actually it's involved in sexual health function as well. So it's really important to understand it's not just about, do you leak if you have a cough or a sneeze, but actually, are you struggling from a sexual function point of view? It's really important that this is the place to start. It is definitely not just for those that happen to be pregnant and need to work on it. It's for absolutely everybody. So women, we know in times of life, we go through certain changes, we go through the potential for pregnancy and delivery, and we absolutely know that our pelvic floor is put under a lot of strain during delivery. It physically has to open up to allow a baby to pass through, and funnily enough, we're struggling afterwards. If this is the case with you, then please talk to midwives. They're a specialist, again, women's health physios, because at that point, we know that it is a childbearing difficulty and we need to strengthen that back up again. So we definitely know via menopause that estrogen acts as a regulator of muscle energy metabolism and muscle cell viability. So obviously, as we go through menopause and out the other side, the cessation of ovarian estrogen production is reduced, and therefore our muscle function struggles. It doesn't mean that we are inevitably going to get problems with our pelvic floor, but what it does mean is we are more likely to struggle, and actually let's get in there before that you do struggle so that we can counteract it. So men, we do know that aging affects metabolism in you as well, and testosterone levels do lower as we get older. Sadly, everything seems to struggle as we get a little bit older, but our body composition changes, and that includes our muscle mass as our testosterone goes down, and actually also increased body fat tends to happen. So let's get in there before our testosterone levels lower, and actually let's just encourage our muscles to be built nice and strong. We always end up looking at ourselves in the mirror and thinking, well, we want to be looking muscly on the outside, but we also want our muscles on the inside to be working nice and strong too. So if you've got symptoms, you may not talk about it, but actually it's something that happens to so many people. And the more that you talk about it, the more it just becomes a normal way of living. And actually, well, if you've got problems, or I've got problems too, I went to see this person, they did this talk, I've done this, it's really helped. I do know that some of the ladies I used to see, they would come in potentially even with a grade 2 prolapse. And by the time they'd finished with me or I'd finished with them, they did not need surgery anymore. And if you can really get hold of doing these exercises on a day-to-day basis, then we could be making a difference for you. So do you leak when you cough or you sneeze? Do you leak if you jump up and down on your child's trampoline? Do you have an urgency and need to pass urine? Could be the fact that you've got an overactive bladder, and we can try and calm it down. If you leak with urgency, so I've got to go, oh no, I've already gone, then this could be urge incontinence. We can definitely help you here. Increased daytime, nighttime urination over the daytime, as in more you're going, more you can't hold it in between sections of time, which actually, now that we're not necessarily all at work and we've got a toilet on hand, you might then find going back out into society where you can't find a toilet too easily, that actually you've got a slight lack of control, and we can build on this. Do you have erectile dysfunction or sexual function problems in general? And again, this is the first place to start. So what do we do? Well, we're going to try and look at you from a whole. So obviously my physio background is very much exercises, but what else can we do? Well, we need to look at anything that's irritating your bladder. So things like caffeine. We're all reaching for the coffee at the moment because we can, because the kettle's close by, but actually we need to take action that caffeine is an irritant to our bladder. So we need to make sure that we've got the right amount of hydration from water sources, not just a caffeine source. So please have a check-in with how much caffeine you're drinking versus water, and we should be having 2 litres of hydrating fluid a day. So drinking the right amount of fluids over the day, not too much late at night, so that obviously you're not up during the night, but generally a nice steady flow over the day. If you are overweight, then it is time to look into trying to lose some of that weight, because it is known that if you are obese or overweight, then it does place more pressure on bearing down. So we can sort that out again here at Embrace Nutrition. We can help with this, that's not a problem. And also reducing how much heavy lifting you're doing. So if you are doing a lot of lifting and you know that you are, then again, we need to try and emphasize that we strengthen you up prior to you having a problem. If you've got a chronic cough, let's find out why. First, why you've got a chronic cough. If you have already found out why, you know that you have, and it is just part of your daily living. Again, we need to try and solve your cough, come to Embracing Nutrition. But obviously we need to then look at trying to keep you nice and strong in your pelvic floor so that your chronic cough doesn't keep bearing down and keep on irritating your pelvic floor. So men, how are we going to do this? Women, how are we going to do this exercise-wise? Generally, obviously, our pelvic floor is in theory the same between us. So essentially the exercises are starting the same and then they slightly change direction. But men, what you're trying to imagine is that you're walking into a cold lake and you're going to try and lift your testes away from the water so they don't get cold, but without moving your buttocks. So it's not the big muscles on the outside, it's the little muscles on the inside. And whilst you're trying to hold in a poop. So what you're trying to imagine is that lifting feeling of the hammock that is there trying to hold everything in. What you then need to be able to do is try and relax it down. So we're trying to hold in and then also relax off. Women, you're trying to imagine the concept of there's a tampon in there and it's falling out, and we're trying to hold it back in again, and also trying to hold a poop from the back passage. So there's 2 different types of muscle fiber in the pelvic floor, and we need to work them slightly differently, and we'll go through this. So there's 2 different types. One is fast type of muscle fiber that we need to work by using a fast type of exercise, in, out, in, out, in, out, faster. And then there's a slow type of muscle that we need to work by that holds your bladder potentially for a longer period of time. So we need to work over a longer period of time. So how do we do it? Well, the concept goes, the more gravity that you've got pulling down your pelvic floor, the more you're going to try and have to lift up against it. So if you're really struggling, you need to start by just laying down to take gravity away as much as you can. So try doing these exercises that we're going to go through, laying down first. And then obviously when you then add a little bit more gravity by sitting up, you can make it even harder by then standing up. So that's how we're going to grade it without any use of Kegels at the moment. We're not talking through that. We're just talking what you can do yourself at home, nice and easy. So I generally suggest, unless you're really struggling and you need to lie down, that's fine, not a problem. The next step is sit back in your chair, nice and relaxed. It should be a relatively hard chair where you're really sitting on top of your bum bones, because then you get to feel what's going on. When we're slouching, it's too difficult. So shuffle yourself right back into your chair with your feet flat on the floor, your knees at 90 degrees and your hips at 90 degrees. What you actually want to do is relax. So your first step is always relax everything off. Relax your abdominals, relax your pelvic floor. And what we then need to understand is connect your body, your brain to your body, and be able to say, am I nice and relaxed? And then I'm going to contract, so that you understand the two differences. So check in with your breathing, because your breathing shouldn't change. You should not go to be able to pull your pelvic floor in. Your breathing should stay exactly the same whilst you're doing your pelvic floor. So what we're trying to do is just catch up with your breathing, have a check-in, breathe in, breathe out, breathe in, breathe out, and you're going to keep it doing that whilst you're squeezing up and in. So females, you're trying to just sit nice and relaxed, relax it off, and then you're trying to go and squeeze in and up, as if you're trying to feel your tampon not sliding out and you're trying not to trump or let a poop fall out. Men, you can stand in theory relaxed in front of a mirror, and you should in theory, when you lift up, feel and see your scrotum rise upon squeezing. And it's quite important to get that feedback from the mirror, otherwise it's quite difficult. So keeping your breathing the same. I've said here, so you can either sit nice and relaxed in a chair, or men, you can have a stand. And what you need to try and do is keep your breathing going and squeeze up and in. Okay, so what we're going to do is follow these slight images that I've created. So the short, sharp squeezes in, what you want to try and do is, in theory, 10 short, sharp squeezes up and in as high as you can lift it. So what you're trying to think is front and back, women, you're trying to squeeze up and in and hold it as high as it can go, and then relax it back down again. So we're going to do 10. So you squeeze up and in, hold it, relax down again. Up and in, hold it, relax down again. And you want to try and do 10 of those. And the next step, so they were the fast squeezes, the next step is the longer hold ones. So these are the ones where potentially you're out shopping and you think, I can't get to the toilet yet. So actually my longevity muscles need to be able to hold up and in. So what we want to try and do is hold and up and in as high as you can get to. So as high you can lift in, and hold it for, in theory, 5 to 10 seconds. But if at start that you struggle to 5 to 10 seconds, not a problem at all. Most people are going to struggle with that. What you might feel, if you can really connect your brain down towards your pelvic floor, is that you squeeze up and in and you can hold it, and actually you're faltering down after about 3 seconds going, I just can't keep it in anymore. Not a problem. If you try and remember what point you got to, so 3 seconds, I felt like I was a good hold, and then it all fell apart. Not a problem. We're going to build on this and it will get easier, okay? So just remember these two types of different exercises, which are short, sharp, up and in, and then holding for longer. So they're your first set of homework and exercises to be doing. What you want to try and do is aim for 10-second holds, but you're aiming for it, but try and do 5 to 10 of them. Now, what I suggest is that you turn this into something that you do regularly over the day. I guarantee if you do not do this more than once a week, it's not going to make a difference. If you did it every single time that you flicked on the kettle, ideal, because how many times are we making a cup of tea? Let's hope it's herbal tea, because it's meant to be hydrating, not coffee. So if every single time that you flip the kettle on, you have a stool by the kettle and you sit down and you do this, I guarantee by the end of the 3 weeks that we're going to be doing it for, you will feel different and you will be able to hold it for much longer than you were to start with. Okay, so that's your number one. You've got to be able to do something every day that reminds you to do it. So stick some sticky notes up. I've had a couple of people say, oh, it's great, I do it every time I go for a wee. Please don't do it at the same time as having a wee, because what you're actually doing is going, I'm relaxing my pelvic floor to have a wee, and then I'm confusing it by holding it up and in, even though I'm actually relaxing to go for a wee. So it's fine to do it the one time you need to be able to feel what it feels like to hold your wee and to hold your pelvic floor up and in. But if we do it any more than once, you're encouraging the concept of fluid staying up in your bladder when actually you're trying to empty it, and it can encourage a chance of infection. So if you need to check what you're doing from a squeezing point of view, if you're doing it right, then please do it once, have a wee, try and stop your flow mid-wee, but please don't do it more than once. Okay. The other ways of actually checking is, in theory, females, you can put a finger up and you can end up finding, can I squeeze around it? Yes, I can. That's the right feeling that I'm doing. Okay. So the next step of exercises that we want to try and do, and now this is the one where we're going to gain control over your pelvic floor fully. So imagine that your pelvic floor has 5 floors to it, and your, in theory, pelvic floor is a lift, and you're going up to each different floor. So what we want to imagine is we're on floor 0, relax, no activation. Let your tummy relax, let your pelvic floor relax. What you want to do is you press the button to go up to number 1. So we're going up to floor 1, which means you lift just a little bit to floor 1. Then you're going to hold it there just for a second or two, and then you're going to go up to floor 2. So when you go to floor 2, you're holding up and in a little bit more. Hold it there. And pressing to the next level, hold up and in a little bit more. Then you want to get to the very top, level 5. You're at 5 and you're holding as high as you can hold it. And then what you want to do when you get to the end is just go down nice and relaxed to start with, but do not plummet to the floor. No one in a lift wants to plummet to the floor. You gradually slide down. In time, we're going to go up 1, 2, 3, 4, 5 to the top, and then down slowly, which is hard, where you're at the top and you're relaxing down little by little by little by little until you're down at 0 and you're relaxed again. If you can manage that, you have got a really good control over your pelvic floor, particularly because you can go from relaxed, which is really important to be able to relax, up to the highest level that you can hold your pelvic floor, and then graduating it back down again until you're nice and relaxed. Okay, once you can do this and you can go from 0 to 5 and 5 to 0, then you've got pretty good control over yourself, and you can do your 10-second long holds up and in at level 5, and you can do your 10 ups and downs. Then you're doing really well. So that's how to strengthen your pelvic floor just with what you have at home with your own ability, rather than having to buy any Kegels or doing anything else. So it's a good start for somewhere where you can do it 5 to 10 times a day. You know what you're doing, making sure that you're relaxing down as well, because it is really important for those that I have seen that have got quite tight pelvic floors, i.e. they're constantly slightly irritated and really working. You need to be able to relax them off and understand how to relax to be able to then work them. So that's really important to relax off too. So if you've got feelings of urgency, this trick works really nicely. So this is for those that have just pulled into their driveway and they're desperate to get to the toilet and they're thinking, I don't know if I'm going to get there in time. Well, your brain is then going, I know there's a toilet nearby, so I'm going to just go, versus you going, don't you dare, I'm not there yet. So this is where you can come in and you need to take a breath and you need to tell your bladder to stop being irritated and trying to squeeze out the wee. So you're going to say, I've got my bladder that's going, squeeze it out, and your pelvic floor going, don't you dare. You're saying, I'm going to work my pelvic floor, because only one muscle can be active at the same time. Either your bladder is spasming and saying, go for a wee, or your pelvic floor can talk. If you can make your pelvic floor talk, it can normally shut up your bladder, which is spasming. So at the point where you're going, I'm getting my keys out and I think I'm about to dribble, is the point where you're going, let me just give me a second and do my pelvic floor. So if you do your activation of your pelvic floor, it should switch off your bladder. So that's a really lovely trick just to get yourself able to get to the toilet without you then feeling like you're going to leak and that you're in control. Your bladder is not in control. So shut your bladder up by doing your pelvic floor and hopefully reducing your urgency, meaning you can get to the toilet. Okay, so that was like a whirlwind tour of your pelvic floor. What you need to do though is, if you're finding that this isn't working, there's more going on than this, it's really important to talk to your GP. Get a referral for women's health, men's health. Don't delay, because there's lots that other people can do. You can see a specialist in it. Obviously, I know this is just the start. So if you have anything else you would like to talk to us about, obviously here at Embrace Nutrition, I am a physio, but I'm also a nutritional therapist that's functionally trained. So if you have any issues with your health, top to toe, to do with your guts, to do with your bladder, to do with your skin, your health, anything, you can come and talk to us. But obviously pelvic floor is just something that tends to pop up with people for whatever reason. Everyone might actually be struggling. So Send this video around to anyone else that you think might be struggling. Start talking about it and let's make it more normal. Lovely to see you all. Take care.